Hi, I'm Catherine. I'm going to be your nurse today. We're going to do a little assessment on you. How are you doing?
Wonderful.
What's your name?
Molly.
All right. Let's get started. I'm going to get your blood pressure. Do you ever have high blood pressure?
Yes.
Okay. How long have you been dealing with high blood pressure?
6 years.
Okay, let's see what it's like today. Just relax for me. A little high, 162 over 84. Do you take blood pressure medicine?
Yep.
What do you take?
It's in a long.
Okay. I'm going to go ahead and get your temperature too. Perfect. 98.0. Okay. Now we're going to do some testing of your cranial nerves. So this involves a lot of sensory. We'll be testing like your smell, your vision, your facial nerves. So it's a little bit interactive, so you just kind of have to go with me on it. I'm going to test your smell first. I'm going to bring some different items in. I'm going to ask you to close your eyes. And what I'm going to do is block off one piece of your nose at a time, one nostril at a time. And I'll have you smell and see if you can determine what that smell is. And then we'll do something else on this side. And we'll just go back and forth to see how that works for you. Okay? Mm-hmm. Close your eyes for me. And take a large breath in. All right, can you tell me what that is?
Some coffee.
Okay, good. Okay, now we're going to use your other nostril. Take a deep breath in. That's a little.
It was a hot sauce.
Okay. Okay, now we're going to do the other nostril. Deep breath.
It smells like some alcohol.
Okay. And we've got one last one.
Garlic.
All right. Did pretty good with that. Let me get my pen. Okay, now we're going to test your vision. We're going to do long distance vision with this chart right here, the side chart that I have. It's going to be 20 feet away, and I'll just ask you to read off the chart. And then I've got a smaller chart to test your near side. So if you can go ahead and get up, and we'll walk over to here on the edge of the couch, I guess. Let's see. Yeah, right there. Okay. And we've got this Snellen eye chart. I'm going to put 20 feet away. And I'll have you read from the top to the bottom, one line at a time. Read the first line for me.
E
Second line.
F P
Third line.
T O Z L P E D P E C F D E D F C Z P F E L O P Z D D E F P O T E C.
Okay, great. Now I'm just gonna have, we're gonna put this piece of paper over your eye, and we'll have you read a few lines with using each eye. So put this over one eye. And then I'm gonna go ahead and let's see if we can read line 5.
P E C F D E D F C Z P
And read line 8 for me.
D E F P O T E C.
Okay, now switch that paper to your other eye, and we'll just use your right eye for this exam. Read line 5 for me.
P E C F D
Go ahead and read line 7.
F E L O P Z D
And can you read line 9 for me?
L E F O D P C T
10.
F D P L T O E O.
And line 11.
I can't read that one.
Okay. Switch to using your left eye, and we'll try and read these last couple lines. Can you read line 10 for me?
Nope.
What about line 9? No?
No.
Okay, so we got line 8. We did that earlier. So that's good. Okay. Okay. And we'll go ahead and test your near sight with this little eye chart. And let's see, cover one eye. We'll use your right eye. And just read on down for me.
E F P T O Z L P E D P E C F D E D F C Z P F E L O P Z O D E F P O T E C L E F O D P E F F D P L T C E O P E Z O L C F T D.
Okay, cover your right eye. And read these last 3 lines with your left eye.
L E F O D P C F F D P L T C E O P E Z O L C F T D.
Okay, good job. You go ahead and sit back down for me. We're going to do a few more tests on you. Okay, go ahead and open your eyes real wide and squeeze them shut real tight. Okay, raise your eyebrows for me and frown and smile. And go ahead and have an open smile. Show me your teeth. Okay. And try to make a face like you're gonna whistle. And puff your cheeks out. Okay, great. Okay, let's see. Now I'm gonna look at your pupils. So I'm gonna shine this light. Just keep both eyes open and look straight ahead. Okay. Great. Okay, now I'm gonna go ahead and ask you to, well, I'll explain it to you first, then I'll ask you to close your eyes. I'm going to do a little test for sensation on your face to make sure that your nerves are all intact and you can determine what's a dull sensation or a sharp sensation. So I'll be pricking you on your face. So you go ahead and close your eyes, and I'll ask you if it's a dull or sharp sensation. Is it dull or sharp? Dull? No, sharp. Okay. Sharp. And where is that? Cheek. Left or right? Right. Okay. Sharp. And where is it at? Left. Cheek. Chin. Chin. Okay. And dull or sharp? Sharp. And where's it at? Right. Forehead. Okay. Dull or sharp? Sharp. And where's it at? Right. Chin. Okay. Dull or sharp? Sharp. Where's it at? Left cheek. Alright. Keep your eyes closed. We're going to do another set. Dull. Where's it at? Right cheek. Dull. Where's it at? Left forehead. Dull. Okay. Where's it at? Right chin. Sharp. Where's it at? Left cheek. Okay. Good. Okay, now we're going to do some tests on your hearing. We're going to do what's called a Weber's test and a Ryan's test. What I'm going to do is use this little tuning fork. I'm going to strike it, and it's going to emit some vibrations. And we're going to put it on top of your head, and that'll determine if you hear good by air conduction and if you have balanced hearing on both sides. So we'll do this first. Can you hear both sides, or is one side louder than the other? Both sides. That was the Weber's test. Now I'm going to do the Ryan's test, which I'm going to strike it and put it on the back of your ear on this bone. And what you'll do is you'll just let me know when you can't hear it anymore, and then we're going to put it in front of your ear, and you'll tell me when you can't hear it in front of your ear. Okay, so I'm going to come around. Just tell me when you can't hear it. You can't hear it. Okay, tell me when that stops. It stopped. Okay, now we're going to try your right ear. Can't hear it. Good. Now I'm going to do another test on you that also involves hearing. I'm going to go ahead and go behind you, and I'll whisper 3 things in a row. It could be, we'll do a combination of letter and numbers. And you just let me know what you hear. And try and recall what I said to you. Okay?
3, 4, T.
Okay.
SQ5.
All right, great. Okay, and I'm going to grab a glass of water for you, and you'll take a few sips, and that's just testing your vagus nerve to make sure that you have good control of that. So I'll grab that real quick. Okay, there you go. All right, great. Now I'm going to take this light again, and I'm going to examine your throat. So I'll just have you open up real wide. Okay, open it up. And say, okay. And stick your tongue out straight. And try and lift it up towards your nose, as if you're going to touch your nose. And down to your chin as if you're going to lick your chin. Now stick it out and move it side to side. Okay, great. Okay, now I'm going to feel on your head and neck for your lymph nodes. Just make sure that there aren't any abnormalities, anything that's too large or out of the normal. Okay, I'm just going to go ahead and come behind you real quick and palpate on your skull. Just look down for me. Okay, now I'm just going to palpate your lymph nodes. Just keep your head straight. Okay. Now I'm going to test the strength of your back. Shrug your shoulders up against the pressure of my hands. Okay. All right. Now I'm just going to use this light one more time to do an exam of your ears, just the outside structures, and your nose. Okay, and I'll look up your nose. And blow air out of this side, in and out. Okay? Okay. Okay, now I need to do an assessment on your lungs. We'll just listen in lots of fields. I'll have you take big, slow, deep breaths in and out. As I'm listening, I'm going to start in the back, go to the middle or to the sides, and then to the front. First, I'm going to palpate your axillary lymph nodes. Make sure that there aren't any big nodes, as I did with your neck. So I'll just have you lift your arm up for me. I hope you're not ticklish. Okay. And go ahead and listen to your lungs. Let's see. I have you face this way, and I'll listen to your back. And like I said, deep breaths in and out. Go ahead and turn around this way for me. Away from the camera. No, shake. Okay. Okay, now you can sit regular. Rock to the sides. Deep breath. Okay, and then I've just got to listen on the front. We're done. Okay, lungs sound clear. Now I'm going to listen to your heart. I've got 4 areas that I'm going to listen to. We just start at the apex of the heart down here, and we kind of move around and listen if you had any murmurs or any problems with certain valves, like a mitral valve or your tricuspid valve. That's how we would better hear that if we listen in the different spots as opposed to just one. Okay. Now I'm just going to check your pulses. I'm just checking to make sure that they're all equal and palpable. And on your feet, your pedal pulses. Now we're gonna assess your abdomen. I'm gonna listen, make sure your intestines are working great. Now we've got all those sounds. And then I'm gonna palpate, do some palpation on your abdomen, light and deep. Some of it will be a little superficial, not so bad, and then the deeper will be a little deeper in. And then I'm also gonna palpate and make sure I can feel your liver, spleen, and kidneys, and that they're not enlarged or feel out of proportion. Okay, I'm gonna have you lay down just like this. And see if I can cover you a little bit. I'm gonna have to get up under this counter. Okay. Thank you. Okay, I'm gonna listen to your stomach. Sounds good. And if you go ahead and get up, I'll get this drape over you to palpate your liver and kidneys, so we don't have you chilling. Okay, go ahead and lay back down for me. I'll drape you. Okay, I'm just going to start off with some light palpation. Okay, now I'm going to do a little bit deeper. Okay, now I'm going to do a little technique to palpate for your liver. Okay, now I'm going to do a technique to palpate your spleen. Now we're going to do kidneys, left and right. Okay, good. All right, now we're going to assess your musculoskeletal system. We're going to do some range of motion, get you to walk. Let me see how you do walking back and forth. Now, I understand you've had a surgery recently.
Yes.
What did you have done?
Right ankle surgery.
Okay, so you just got out of your boot today?
Yes.
So you're just wearing a brace now?
Yes.
Okay, good. Go ahead and get you to stand up and walk a little bit for me. We'll point the camera so we can see. Just take a few steps back and forth right here. Okay, come on back. Okay. Now we're going to do a little range of motion. There we go. And we'll start with your hands. Just flex them up and down, side to side, and around. Okay? And put your fingers out and in, together, and thumbs in and out, and up and down. Okay? Now I want you to push your hand up against the pressure of my hand. Push it up like this. Okay? And then down against. Down. Okay, and then we'll move on to elbows. Flex them and extend them. And out to the side and in. Okay, and then I have you push up against my and push up. All right. Then we'll do some range of motion in your shoulders. Go across like this and out. And then put one arm this way and another arm this way. Okay. And push up against. Okay. Looks good. Now we'll do knees. Up. And the other up. And then like this. And like this. I know that one's going to be a little bit harder for you. Good. Okay, we'll do a little range of motion with your ankles. Flex up on your left. We'll do your left first. And down. Yeah, you can sit up. Okay. Make it easier for you. Okay, flex up. And against. Or go ahead and put it down. And then back up against pressure. Okay, and then do a circular range of motion on that. Okay, and then flex up on this one, down, and then against my pressure. Okay, and then a circular range of motion. Are you having pain with that? Okay. And now I'm just gonna feel for any swelling. I can tell you do have some swelling over in your ankle, your right ankle. You have good pulses. Okay. Now I'm just going to do a general look over your skin. See if we've got any lesions anywhere. Have you got any areas of concern? No. Okay. Okay. All right. That's going to be all. I appreciate you letting me do an assessment on you. Thank you.
You're welcome.